What is up, guys? So I'm gonna do a little bit of an update for you. I'm trying to remember what updates I gave you last time. Anyways, well, I got a new dermatologist scheduled. When I talked to them to make an appointment, I told them I need that medication that I've been on. The lady didn't really say yay or nay on it, but anyways, I have an appointment with them finally, but unfortunately it's not till like September 16th or something crazy like that. I know it's not too far away, but it's like a month almost. And so there's that. I'm still waiting for the neurologist referral, which is weird. I didn't think it would take that long, considering A, he is my neurologist, and B, he's in my network. So I don't know why that's taking so long, but yeah. Or did I get one with him and I just totally forgot because my brain is totally stupid and forgets forgets everything super easily. Let me try to look. Let me just take a look quick. Nope. I didn't get one with him. Yeah, okay, I didn't think so. I'm not that retarded. Sorry. Anyways, so there's that, and I know it's probably hard to tell with these lights, but it's been close, I want to say close to 2 months or a month and a half since I've been off that medication, Skyrizi. And I know how my skin was before it, but I don't know if it's just because it's coming off of that amazing drug. But it's been so bad, especially my face. This morning I had to scrub off all the, plaque and, moisturize it and stuff because I had a doctor appointment and whatnot, and I didn't want to go out looking like that, obviously. But still, my face has been beet red. Like almost all of this has just been beet red, and it's a little embarrassing. But what can you do, right? You just gotta roll with it. Thankfully, no one really stared or said anything, so that was nice. So there's that. I hope they can help me and give me that medication again. I just don't know how long the process will take, if they have to start all the way over because it's a new provider. I don't know. It will suck if it is because I'm guessing maybe a month or two after. Who knows? We'll see. So there's that. I actually had to have my urology follow-up rescheduled because I failed to get the urine test done because A, just super busy, and then B, I forgot in between it, and then so I gotta remember to do that. And then I see my GI doctor follow up on the 17th of next month, which is still far away. And it's like, I hope there's answers with the test he did, or there's more tests he'll do because there aren't answers. I don't know. At first, I was leaning heavily on Crohn's because of just all of the symptoms and stuff. And with talking with my cousin who has it, it just sounded like that was it. But when I was getting another ultrasound scan, I was talking to the lady there who I had last time. And she kind of knows me. She works with my sister. And we were talking about it, and she brought up diverticulitis. I can never freaking say that. Diverticulitis. I don't know, something like that. And so I kind of looked it up, and I really kind of looked into it, and I'm like, well, it kind of makes sense because it talks about how there's these times where you don't feel anything at all, and there's like no pain and everything. That's because because the problem isn't inflamed, and so it dies down, everything settles, and then when it's inflamed, that's when all the pain and problems and issues come in. I haven't read much beyond that because I just kind of ran out of time when I was reading it, and just haven't remembered to look back since. But it makes sense. I'll have to look up though if there's anything like food wise that triggers it. I don't know, because it seemed like I don't know, like it seems like it's been a lot better since I cut out fruits and vegetables. So I don't know, it could be a huge coincidence, but just gotta wait and see. Um, and then, what other doctors are there? I think that's really it. I did make a follow up from my previous rheumatologist since the new one I got, went to UCLA, and I'm not gonna try to, you know, go through that process and it just gets shot down by my insurance, which is unfortunate because she was really good and I really liked her, but it's fine. It means I don't have to drive an hour each time either, so that's nice. Anyway, but I don't get to see my previous rheumatologist till like I think almost October. It's crazy, and it's like, why are these appointments so far apart? It makes no sense. Is it? I know with COVID and everything, they're mostly doing more like web, Zoom type meetings or appointments, but it's like if your patient needs to be seen in person, you should make time for it, and not just like, oh well, I only come in once a week and I'm backed up for 2 months. It's kind of BS, It's like I feel like they're kind of using it as like a crutch or an excuse to be home more often. It's really frustrating, but yeah. So there's that, and I did check. I actually did have a follow-up from my neurologist, and the reason I didn't see it is because it's almost at the end of October. This is what I'm saying. End of October. Before, it was like within a week I could see him. And now it's like 2 months. It's unreal. It's unfreaking real. But whatever. I got it, I guess. The only problem is that that appointment has to happen because the referrals are only good for 3 months. So if for some reason they're like, oh, we need to reschedule, and I'll be like, well, as long as it's within the 3 month time period, sure. Otherwise, I think not. Because, yeah, I'm not going to wait for another freaking referral, It's kind of stupid. But there's that. Not enjoying, I know I've said this before. Sorry, cutting a little hangnail. I'm not a fan of my new pain specialist at all. I had an over-the-phone appointment with them like a week or so ago, and I told her, hey, look, ever since the shots, yes, the pain in those areas has reduced like 90%. Problem is, ever since I've had those shots, my upper back has just gone to crap. It feels like it did months and months ago when I had to have physical therapy, when the spine was, I guess, going in curved like this direction and or twisting at the same time. And I told her about this, and I told her that started up again once you guys gave me all these shots. And on top of that, there's this, on the right side of my back, there's like this weird curved muscle that constantly feels like I've pulled it nonstop. And the more I try to stand or sit straight, the more I feel the pain in that muscle and in my upper back. And so it's like it's kind of forcing me to kind of, not that bad, but it's still forcing me to slouch when I should be like this, But it hurts too much if I do it for more than like 10 minutes. So it's super frustrating on that front. And when I told her all this, she's just like, well, let's see, you still have one more neck injection, and then we'll do pinpoint injections after that. And I think those are like when they go into the muscles and inject stuff. I don't know what it is, if it's steroid or what. But if that doesn't help, then they're just like useless, because it's like, what good are you? They're like, we're going to do all these injections, and then after that, we're going to shove you into physical therapy, which is going to suck. And it's going to be like a couple months worth of just hell and whatnot. And they're like, after that, then we just, in January, we'll just restart the whole process all over again. I'm like, sweet. So 3 months, 4 months of shots, 2-3 months or more of physical therapy, maybe a month off for break, if I'm maybe, and then starts all the way over again. Cool, it's fucking unreal. Sorry for the language, but damn, that is just insane, you know. So it sucks, but I don't know what to do. There's no one else out here that they can find, and I can't go outside of my county. It doesn't work that way. So I'm kind of just stuck with it for now. I hope that my primary doctor finds that specialty, whatever she said, that will offer the nerve burns, and that if they do, that I can go see them for that, because this other place just sucks. And then on top of that, they only were willing to prescribe my tramadol and my Flexeril. And when I asked for the pentatoxylane for my small fiber neuropathy, they're like, "Oh, we don't prescribe that here." I'm like, "Why not?" And they're like, "We just don't do that type of medicine here." I'm like, so cool. I wish I knew that like a long time ago when I told you those were my medicines. And so now I had to scramble and get my primary to re-prescribe it, and even as it is, it's still not here. And today I'm completely off of it, and yes, I can notice a difference. And two, I don't want to know what tomorrow's going to feel like, because usually the first day is not so bad. It's the second day that really sucks. So yeah, that's going to be real fun tomorrow. If it doesn't come before tomorrow, which is not, it's already 6:30. Mailman's already gone. So that sucks. On top of that, yeah, I think that's the most part for updates. In terms of how I'm doing, mentally, physically, honestly, I don't even know. I'm constantly tired. I'm up most of the night, every night, and then I like nap 2-3 times a day, mostly like twice a day actually, if that, you know. So maybe I get like 3 hours here and then 3 hours another time in the day, and then I'm up all night, and it's fine. But even like I'm still like get tired, and it's like I could literally last night I actually got to sleep all night, and I got like 7 hours of sleep, something like that. And I still felt tired all day, you know. And it sucks. And it's like, I'm sure it's part medication and part just health in general, but it really blows. Let me tell you, it really blows to not get enough sleep, even when you're getting enough sleep. But you know, I guess it is what it is, and it's always kind of like I keep saying, it's just getting used to your new normal, and it's never fun and it's never easy, and it takes a while for your body to adjust to that. And yeah, so that sucks. I did find out about the swelling in my legs, in my feet and ankles, all that. My sister was right from the start. It was my varicose veins, or venous insufficiency, or whatever. I don't know, my brain can't comprehend. Anyways, basically, yeah, the veins are getting tired and exhausted. It can't shoot the blood back up because the varicose veins are like branching off and doing weird stuff. I don't know the whole process, and I'm not really care to look it up. But essentially, after my sister, she did the scan of my legs, and she's like, yeah, that's exactly what I said it would be. And then my doctor's office contacted me and said, okay, so this is what it is. I'm like, yeah, no, duh, I told you that at the very start. You should have listened to me. Or it saved me a lot of time and blood work and just hassle. But anyways, they're sending me to like a surgeon of sorts that I guess deals with that stuff. So I'm just waiting to get the AOK referral on that, and then obviously make an appointment with them. So yeah, that's basically it. and obviously the cramping and muscle issues I've had down in the lower extremities is not due to the swollen legs. It's probably due to the CMT that I most likely have. So that really sucks because it's like so bad, especially in my feet. It's insane. I'll literally like just in the middle of the night be like, trying to crack and bend my feet because I have to every so often, otherwise it hurts down to. And when I do that, sometimes the foot, like right in the center and towards the top, it seizes up, and my toes and feet kind of like all do this weird contortionist stuff. It's bizarre, and I have to get out of bed, stop my foot on the floor, and force it into a normal position to get it to stop. Otherwise, it just keeps getting worse and worse and worse and worse until it's like, yeah. Of course, the calf muscles are the worst, though, because those are painful. The feet one is just, for the most part, it's not that painful. It's just uncomfortable. But when the calves seize up and Charlie horse and all that, oof, that's painful. So, yeah, thankfully those have been a little bit better, but still not great. So, but anyways, that's it for my updates. If I have anything else again further on in the week, I'll make more videos for it. I know I've been mostly doing update videos. Just like I said, life's been crazy and different, and trying to find my new normal has just been very tough and frustrating and obviously painful. So I'll post when I can and what I can, and I appreciate all of you who come on by and watch my videos and just give me the love and support and everything. And so I appreciate you guys, and I hope you guys have a good rest of your week. Bye.